I'd like to welcome you back to the show. Paul Seegert is a managing partner at PCS Advisors. What does that mean? Well, he's our go-to health care expert. And folks, again, this is one of the biggest sectors of our economy, and it's also one of the biggest sources of worry, angst, and suffering. And that is how well does our healthcare system function and who's able to afford it? And Paul, what Paul does is he helps companies manage this expense to the betterment of their employees. If you want to hear more about it, you can call me and I'll put you in touch with Paul, or you can go to pcsadvisors.com. Paul, welcome back to the show.
Very glad to be here.
Well, let's talk about the debt ceiling. So, folks, think about the debt ceiling as the maximum credit limit you have on your credit card. What happens if you maxed out every single credit card you have? Well, you could either realize you got a spending problem, income problem, and spending problem, or you can call one of those guys up and beg them to give you more credit limit. That's what's happening in the federal government. The Republicans are saying we've got to quit spending this much. The Dems are saying we got to keep spending this much. What's it all got to do with healthcare, Paul?
Well, a whole lot, really, because one of the biggest purchaser of healthcare in the world, and certainly in this country now, is the U.S. government. We'll see how it shakes out after they start to audit Medicaid rolls again, now that the public health emergency for COVID is finally over. But during this stretch of time that we're just getting through, we've gotten to a place where 51% of us get our coverage from a government program, Medicare and Medicaid. And then even more than that, the number would climb even higher if you include those who get a subsidy. So some portion of their premiums are paid by the government when they go to the exchange or the marketplace. And what happens when this debt ceiling doesn't get extended, the federal government wouldn't be able to pay providers that are taking care of those patients, Medicare and Medicaid people, either the Medicare patients who get paid directly by the federal government, or the matching funds that the states get from the federal government for their Medicaid programs would be unfunded. And we're already at a crisis point anyway, as we've discussed before, when it comes to especially rural or poorer urban facilities like hospitals, who rely on this kind of funding almost entirely for their customer base, their payer mix. And you can see what kind of a disaster it would be if they're already stretching these facilities out sometimes 6 to 12 months to get paid after you go in and get care. And then they're not even going to make payments on some of those things that could have occurred many months back. And then they'll add wait time to procedures that are continuing to occur during however long this potential shutdown could last. It will no doubt, if this happens, we will lose more hospitals in those affected areas more quickly.
So one of them, I read this one piece here, where this one guy says this. He says, the Biden administration will pursue what they call the Washington Monument Strategy, which is, we're going to shut down the most highly visible, highly valued stuff first, i.e. Medicare. Then we're going to tell you that that's what we're going to do, get everybody angry and tell hospitals, sorry, we can't pay you. But that's a choice on their part, right?
Yeah, I mean, that's true. And unfortunately, that would put half of our population's access to care at risk, or at least affected negatively, so that, the politics could play out. And in fact, one of the possible outcomes, when I go back earlier in my career, when the Affordable Care Act came out, some of the providers, I was working in the Central Valley of California, and a lot of the providers were our customers. And so many of their offices shortly after it rolled out, had signs up that said, we do not take Affordable Care Act plans because the reimbursements were less than if you had that same brand on your card, but it wasn't an exchange plan. Well, the same thing could happen here.
Yeah.
Where they say, hey, we're just not going to take these people.
One of the other things, though, is there was a bill, the Ways and Means Committee approved a bill that would allow for additional debt obligations to pay for Medicare benefits and prioritize payments in the event of a debt limit breach. So one thing, Biden's got choices here. One choice is he can negotiate with the Republicans because, folks, all this spending is spending us into oblivion, right? Number two, they could sign that bill that carves out Medicare and make sure it gets paid.
Yeah, it'll be interesting to see what happens here. Hopefully they standoff is resolved and they figure out a way to get through this in a way that doesn't create this big mess.
But the bottom line, folks, is we've done a lot of shows on this. The providers right now are not getting paid for Medicare and all the rest. They're getting paid pennies on the dollar. But at the same time, our military is woefully funded. They're spending too much money on other things. That's the problem. They're not paying the stuff they should pay. They're paying too much on other things. Paul?
Well, I think that's a fair point. If you look at the amount of money it would take to keep these things going, and I'm no geopolitical expert. I'm just looking at numbers here. And then you look at the amount of money that we've spent supporting wars in other places in the world and things like that. We have we're blowing through a lot of cash. That's one problem. Then another problem is that we allow this system to continue in a way that is intentionally inefficient, and we allow these healthcare conglomerates to form that drive up cost to consumers and to health plans in such a way that even without this debt ceiling situation staring us in the face, it's already unsustainable. I'm genuinely surprised to see how we can continue to allow this to go on. But then it just shows you the power of lobbying. 14 or 15 lobbyists for every member of Congress. You can prevent change pretty effectively.
All right, we're going to be back with more of Paul Seegert. We're going to talk about this absolute crisis in rural communities across America. The hospitals are closing, and or the ones that haven't closed are on the verge of going belly up. You're listening to the Andy Caldwell Show. Stay tuned.
Looking out for labor, agriculture, and business each and every day. It's the Andy Caldwell Show, brought to you by COLA.
I'd like to welcome you back to the show. Our guest is Paul Seegert, Managing Partner, PCS Advisors. He's our go-to healthcare expert guru, and he's always telling us what's really going on out there and what you got to be worried about. And one of them we just talked about was the debt ceiling. This is this issue of how much more money can Washington print, borrow, or steal to pay its bills. And the Republicans want him to stop spending that much and prioritize his stuff, but Biden doesn't want to negotiate. So Medicare is hanging in that balance, but something else that's hanging in that balance is rural hospitals. Rural hospitals, hundreds of them have closed in recent years, and hundreds more are on the brink. Paul, tell us all about it.
In the last few decades, we've lost 300. We have about 2,000 left. But even the 2,000 that we have left, many of them are at risk. 30% are at not just under pressure, but at real risk of closure soon. And, it's more than half are operating at a loss. So they can't do that in an ongoing forever way. They can't just print more money. So they have to figure out a way to survive. And we've really put the hurt on them over the years because of reduced funding from programs like Medicare and Medicaid, and just reimbursements that don't cover the cost of care or barely do. And they were already in a tough spot. It's been very tough. This is how tough it is. You've got half of the rural facilities that are left that don't offer maternity care. So you have people that have to drive, in many cases, over an hour to have their baby. And as a father of 5, and I know you've got a big family too, that's a pretty long way to go when you're not exactly sure if you might have to deliver that baby yourself. So it's a tough, we're putting them in a difficult place. They deal mostly, their customer base is mostly Medicare, Medicaid, and uninsured. And if we say we're going to cut off paying you your Medicare and Medicaid people, and they're uninsured, often go unpaid and they have to write that off, we will absolutely accelerate the demise of many of these facilities. I'm not hearing you, Andy. Are you getting me?
Oh, I'm sorry. That was my fault. I was coughing again. I've been coughing today. I'm sorry. Anyway, a 2019 study found that rural hospital closures increased mortality rates in the hood by up to 9%. So people are dying.
That's true.
Already.
Yep. Oh, it's life and death. It is life and death for people. I mean, if you have that, the populations in those areas tend to have more chronic illness. So you have more heart disease, you have more diabetes, you have more obesity, you have things that lead to the need for urgent medical care. What do you do if you're having a heart attack and there's nowhere to go for an hour? It's just not a good situation. And it is measurably impacting lifespan for people. And we're creating a system of haves and have-nots that doesn't, and we don't have to. It's really a shame.
So let me give you the statistic here, folks. So first of all, a lot of the people out there are elderly and or poor. Rural adults have a 19% higher risk of heart failure than urban counterparts. They have higher rates of obesity, hypertension, and use of drugs such as tobacco and meth. Now, I don't know about older people with the meth. Those are probably the younger people that can't find jobs in those rural areas. Mm-hmm. And what about the issue of how did vaccination rates have affect all this?
Well, they did have a bigger challenge in getting people to get vaccinated. If you're referring to this public health emergency that we're ending. But it said after vaccination began, the COVID death rate was 33% higher in rural areas than urban. Were they not getting vaccinated? There was a lack of vaccination, sure. And then there was also just knowing that one of the biggest risk factors for COVID was being overweight or obese, and that's more common in those areas. So you have more comorbidities. You have less access to healthcare. We're creating healthcare deserts in areas. So you have a sicker population, and you have less access to healthcare.
So what happens? What's the solution? Does the federal government, is this the state government or federal government's responsibility?
Well, there's responsibility on both sides. I do think a lot of it tracks back to the federal government, because you have Medicare, which is a federal government program, and then you have Medicaid, which is a program, of course, that's shared between federal funds and state funds. And in both cases, these programs do not reimburse facilities enough for their survival. You can ask, and I have rural hospitals as clients. I have CEOs of rural hospitals as friends. You can ask them, how can we fix this? And they say, well, it's really easy, actually. You have to compensate the government shouldn't expect private payers to subsidize their people that they're paying for. And that worked fine 20 or 30 years ago, and two out of three of us got our coverage at work. Those facilities could turn around and charge that person that walked in the door that had a health plan from work $10 for something that they would charge, that the government would only pay $3 or $5. That worked. We're not there anymore. When you keep whittling down the number of people that are in those commercial paying plans, those employer paying plans, then you're squeezing those facilities harder and harder. And then it's just a question of how long can they hang on before they pop.
Well, one of the things that I read in one of these pieces made me think. I just turned 65. And one of these guys said, hey, it's not a good time to rely on Medicare. Like you said, there could be a sign going up in the doctor's office. We're not getting paid. We can't treat you. I just don't know what the government does because, again, part of this is I think they put too many people on government health care. And I've never understood this. For instance, Santa Barbara County has at least a dozen clinics, healthcare clinics, including their own OBGYN delivery facility. If you got free health care, why are we paying for insurance as well? In essence, and then plus, there's waste, fraud, and abuse in the system. I remember a friend of mine told me one time there's an employee, a husband and a wife, both worked for him. Both of them had full coverage. They went down to that county clinic and said, we don't have insurance because they didn't want to pay their copay. And I just feel like they're not dealing with waste, fraud, and abuse, and they put too many people on these roles that don't necessarily need to be on those roles.
Oh, this public health emergency proved that. And by the way, it's not a little bit of waste. There's all kinds of studies that would say there's a ton of waste in Medicare. Some say it's as high as $1 out of $3 that Medicare spends is waste. Others will pinpoint it at $50 billion a year. And there's not just one source that says that. There's many. Imagine if we could fix that problem. If we could stop wasting $50 billion, could we compensate these rural hospitals at a level that would allow them to be profitable? I think we could.
I don't understand why they can't get to the bottom of this. I really don't understand.
Well, I just think there's a lack of will, a lack of political will to do anything about it.
Yeah, but they're letting these hospitals close. People are dying, and the doctors are going broke. They have to see. That's the other thing, folks. Is the leaving. Doctors? Yeah, they leave. They have to leave. It becomes a ghost town, and this is one of the things that if I ever retire, if I ever move. First thing I have to look at is what kind of healthcare facilities do they have there? And the cheapest places are the ones that don't have any.
Right. That's true. And if you're, here I am with a relatively young family. And when I moved to Tennessee recently from California, one of the first things I did was figure out, okay, where's my closest urgent care, ER, everything else. That was a factor in us making our decision as to where to go. And it needed to be a place with high quality access to healthcare, good schools, all the things that are important to you. That's absolutely one of them.
Well, and again, the other thing going on here in this heartland issue, because a lot of these rural communities, there's rural communities in California. You can go into the San Joaquin Valley and find places. In fact, when I was a little kid, this is in the 60s, going back a ways, I lived in a little town called Kingsburg, California, and they had a little hospital there. Well, I had asthma really bad back then. Real bad. And I think I had asthma and the flu, and I just flat out could not breathe. And I told my mom, you got to take me in. It was after hours. So, we went to the hospital. We went in there and the nurse checked me out. She called a doctor. He didn't want to come in. I almost died. I went code blue.
Yep.
Hey, we're out of time. Paul Seegert, thank you so much for being with us, folks. We'll be back. You're listening to the Andy Caldwell Show.